Today, we are going to look at a BodyViz brain builder about joints and osteoarthritis. Arthrology is the study of joints, and a joint is defined as the junction between two or more bones. Joints are classified according to their potential for movement at the joint. There are two major classifications for joints: Synarthrosis and Diarthrosis, also termed Synovial joints. Synarthrosis joints allow for little or no movement between the junction of two or more bones. There are two further subclassifications within synarthrosis: fibrous joints, where fibrous connective tissue joins the bones of the joint. Examples of a fibrous joint would be the joint between the tibia and fibula of the leg, or the sutural joints between the bones of the cranium. The other subclassification is cartilaginous Synarthrosis joints, which have fibrous or hyaline cartilage joining the bones of a joint. Two examples are the joints between the adjacent vertebral bodies, which are joined by fibrous cartilage, and the joints between the ribs and the sternum, which are joined by hyaline cartilage. Next, let's learn more about Diarthrosis joints or synovial joints. Synovial joints allow for a considerable range of motion and have 7 anatomical characteristics, which are 1. Joint capsules composed of fibrous connective tissues surrounding the joint. 2. Hyaline cartilage covering the articulating surfaces of the bones of the joint. 3. Synovial membranes lining the inner surface of the joint capsule. 4. Secretion of synovial fluid by the synovial membrane. This fluid fills the joint capsule, nourishes and lubricates the hyaline cartilage covering the articulating surfaces of the bones of the joint. 5. Presence of localized fibrous connective tissue thickenings of a joint capsule. These thickenings are termed ligaments, and they serve to limit extreme range of motion at the joint. 6. Small blood vessels and capillaries penetrating the joint capsule. And finally, 7. Sensory nerves supplying the ligaments and external layer of the joint capsule, with receptors for proprioception and pain. Not all synovial joints are able to move in all 3 axial planes. Some joints, termed uniaxial joints, are able to move in only one axial plane, such as the humeral radial joint of the elbow. Other joints, known as biaxial joints, are able to move in 2 axial planes, such as the carpometacarpal joint of the thumb. Finally, some joints are multiaxial and are able to move in all 3 axial planes, such as the glenohumeral joint, which is the joint of your shoulder. Next, let's learn more about arthritis. Arthritis is the presence of chronic swelling or inflammation at one or more joints. The 2 most common forms of arthritis are osteoarthritis and rheumatoid arthritis. Osteoarthritis, which typically involves the hips, knees, or hands, is the most common form of arthritis. With osteoarthritis, the hyaline cartilage covering the articulating surfaces of the bones breaks down, affecting the deeper bone tissue. These changes progressively worsen slowly over years. Rheumatoid arthritis is an autoimmune disease in which the immune system attacks the synovial membrane of the joints, ultimately causing bone destruction and deformation of the joint. This form of arthritis typically affects multiple joints simultaneously, most commonly involving the hands, wrists, and knees. Next, we will look at the symptoms, causes, and treatments for osteoarthritis, and finally give a patient example. Symptoms of osteoarthritis include pain, stiffness, tenderness, loss of flexibility, grating sensation, bone spurs, and swelling around the joint. Common causes for osteoarthritis are obesity, gender, with women over 50 years old are affected more frequently than men, age, joint injury or overuse, and lastly, genetics. People with family members with osteoarthritis are more likely to develop osteoarthritis later in life. Osteoarthritis can't be reversed, but treatments can reduce pain and help you move better. Possible treatments include medications like acetaminophen and anti-inflammatory drugs, therapy, including physical therapy, occupational therapy, and transcutaneous electrical nerve stimulation to help relieve pain. And lastly, surgery, which could include cortisone injections, lubricating injections, realigning bones, and joint replacement. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 52. Gender, male. Chief complaint, joint pain in both knees. You invite the patient into your office for an examination. Your patient explains how recently in the mornings his knees feel achy right when he gets out of bed, and he hates sitting down because he knows how painful it will be to get back up again. You ask your patient if he has had any recent or past injuries to his knees. Your patient says he has not. However, before retiring, your patient was in the military and for years was required to meet certain physical tests that required substantial amount of running. You order an MRI and can see that the hyaline cartilage covering the articulating surfaces of the bones is worn away and affecting the deep tissue of the bone. Your diagnosis is osteoarthritis, and you talk with your patient about possible treatment options. You recommend transcutaneous electrical nerve stimulation to help relieve pain and starting occupational therapy to help him discover new ways of completing everyday tasks without putting stress on his knees. This is a classic example of osteoarthritis. Did you find this video helpful? Please like this video and subscribe to our BodyViz channel to see more 3D anatomy, and check out our website at bodyviz.com.